this is Tony with BariatricTV.com, and I'm with Dr. Dale Bond. And Dr. Bond's released a study at the ASMBS conference, and it's one of the more interesting studies, I think. Can you tell me a little bit about that study?
Yeah, so previously our group has showed that there's a high rate of sexual dysfunction in women seeking bariatric surgery. So in this study, we wanted to see if sexual dysfunction improves after surgery, and that's what we found.
And how much did it improve?
So before surgery, 63% of the women reported having clinical sexual dysfunction. At 6 months after surgery, that percentage reduced to 22%.
Wow.
So what that means is that sexual dysfunction completely resolved in 23 of the 34 women who reported having this dysfunction before surgery.
That's awesome. That's amazing. Why this study? What made you guys do this study?
So our research group is interested in sexual dysfunction and obesity, and bariatric surgery provides a great model to study that because everybody loses weight.
Mm-hmm.
And so, of course, we already knew that sexual dysfunction tended to be higher in this population, and we wanted to see whether this improves after surgery.
All right. And with this study, you talked about an index. Can you tell me about that index that you used to do this study?
So previous studies have shown improvements in sexual quality of life, but our study different in that we use the most widely used measure of sexual function and dysfunction in the world. And so this is called the Female Sexual Function Index. Mm-hmm. And this assesses sexual function across 6 domains. And the unique thing with this measure is it also provides a cutoff score so that we can differentiate women with and without sexual dysfunction.
Awesome. And the results, do you think the improvement was more because of the physical or the emotional side of weight loss surgery?
So that's one limitation of our study, is that we didn't assess those variables. And so what we would hypothesize is probably a combination of both. I would think that maybe some of these improvements are due to also improvements in things like mood and body image. Mm-hmm. Also, there might be improvements in the reproductive hormone profile after surgery as well that may be contributing.
All right. And one of the points of your study was it improved significantly fast after weight loss surgery? I mean, a relative short period of time.
Correct, yeah. So this is 6 months post-surgery. Mm-hmm. So it'll be really important to determine whether these improvements can be sustained over time, because of course we know during this early post-operative period, weight loss is the greatest. Also improvements in health-related quality of life are very high as well. So as weight starts to stabilize, it'll be interesting to see if they persist over time. All
right, well, thank you so much for doing this study.
Thank you very much.
I think our viewers are really going to find it fascinating, and I know I find it fascinating, so thank you so much.
Thank you.
Thank you.